Three doses of Pfizer vaccine can neutralize Omicron variant, lab test shows. Two vaccine doses resulted in significantly lower neutralizing antibodies. By a third dose increased the neutralizing antibodies by a factor of 25. The vaccine manufacturers released their first joint statement regarding the likely efficacy of their shot against Omicron on Wednesday. They claimed that two vaccine doses resulted in significantly lower neutralizing antibodies, but that a third dose increased the neutralizing antibodies by 25. If needed, they can deliver a vaccine specifically for Omicron by March 2022, they added. Their research found that blood obtained from people that had their third booster shot a month ago neutralized the Omicron variant about as effectively as blood after two doses fought off the original virus, which was first identified in China. Although two doses of the vaccine may still offer protection against severe disease caused by the Omicron strain, it's clear from the preliminary data that protection is improved with a third dose of our vaccine, said Pfizer Chief Executive Albert Bourla. Ensuring as many people as possible are fully vaccinated with the first two-dose series and a booster remains the best course of action to prevent the spread of COVID-19. BioNTech boss Uga Sahin added that the latest data indicates that a third dose could still offer a sufficient level of protection from diseases of any severity caused by the Omicron variant. He continued, broad vaccination and booster campaigns around the world could help us to better protect people everywhere and to get through the winter season. The Omicron strain was first detected in South Africa last month, triggering alarms around the world of another surge in infections. More than 24 countries from Japan to the US have reported cases. Last month, the World Health Organization classified Omicron as a variant of concern, but said there was no evidence to support the need for new vaccines especially designed to tackle it, despite its many mutations. The new strain sparked fears that existing COVID-19 vaccines and treatments could be less effective against it. The latest findings of Pfizer BioNTech are broadly in line with preliminary study published by researchers South African National Institute for Communicable Diseases this week, which suggested Omicron was able to evade some immunity, but existing vaccines should still protect against severe disease and death. However, a lab analysis at the University Hospital of Frankfurt, Germany, discovered a reduced antibody response to Omicron even after three doses. Moderna's Stefan Bancel has warned that the current vaccines are likely to be as effective against the Omicron variant as they were against the original strain. The US company has said a new vaccine tailored for Omicron should be available by March next year. Meanwhile, Johnson & Johnson said it was testing blood serum from participants in various trials to look for neutralizing activity against Omicron, as well as pursuing a specific vaccine against the strain. AstraZeneca said it was examining the impacts of Omicron on its jab, which was developed with Oxford University as well as its antibody cocktail, saying it was hopeful its combination drug will retain efficiency. With that said, let us go get vaccinated. Let us keep social distancing, washing our hands, and wearing our masks in order to keep this at bay.